In this video, Sarah and I will be presenting over the Functional Communication Profile Revised, or the FCPR. The author of our test is Larry Irwin Kleiman. The publisher is Linguist Systems. The cost of the assessment is $74, which includes the complete FCPR test kit consisting of the examiner's manual and 15 profile forms. The FCPR is used for those ages 3 and up and is appropriate for individuals who range between mild and profound deficits. The administration time for this assessment ranges from 45 to 90 minutes and varies due to three main factors, which are client behaviors like incompliance, fragile or weakened medical status, delayed responding, inappropriate or aggressive behaviors, and poor attention span or hyperactivity. Another factor is the presence of multiple deficits, where allowances or adaptations for motor or sensory impairments will increase administration time. And the third factor is the presence of profound impairments, where fewer items would be applicable to individuals with profound cognitive and language impairments, so less administration time would be expected. The FCPR is criterion referenced, and its purpose is to assess communicative effectiveness in clients with developmental or acquired delays, including but not limited to impairments like autism spectrum disorder, cerebral palsy, Down syndrome, traumatic brain injury, progressive neurological disorders, childhood aphasia, and attention deficit disorder.
The test assesses students' language-based responses to portrayed peer-to-peer situations, which is unlike other tests which rely on observation forms. It addresses all communication possibilities, including oral language expression. The FCPR yields an overall inventory of an individual's communication abilities, mode of communication, whether that be verbal, sign, nonverbal, or augmentative and alternative communication, as well as the person's degree of independence. Clients are assessed and rated in the major skills categories of communication through direct observation, teacher and caregiver reports, and one-on-one testing.
There is a range of materials needed for the FCPR, and materials will differ on a case-by-case basis. The examiner, who can be a licensed SLP, a speech-language pathology intern, a speech-language assistantship program graduate, a special education teacher or classroom specialist, or a graduate student in communicative disorders, must provide age-appropriate stimulus materials and environmental items which are familiar to the individual to be evaluated. Suggested materials include common objects used for activities of daily living, like eating utensils, grooming items, dressing items, age-appropriate leisure or recreation items, furnishings, and small appliances, as well as drawings or images of common objects, actions, people, emotions, places, and daily needs, drawings, photos, or storybooks depicting story, theme, and problem-solving situations, noisemakers, a light source, an alphabet board, a sample picture communication folder, coins and a dollar bill, colored blocks, a writing tablet and a pen or pencil, and a stopwatch. In terms of the adaptations allowed during administration of the FCPR, individual responses are subjectively rated based on responses to test items. Also, personal adaptations need to be made for bilingual assessment, adaptations may be allowed for motor or sensory impairments, and fewer items may be applicable to individuals with profound cognitive and language impairments. There are 10 subtests included on the FCPR. Subtest 1 looks at the individual's sensory and motor skills, which includes his or her auditory skills, visual skills, gross motor skills, and fine motor skills and behavior. Subtest 2 looks at the individual's attentiveness, which includes his or her attention span, alertness, response levels, cooperation, and level of awareness. Subtest 3 looks at the individual's receptive language abilities, which includes his or her comprehension of verbal and nonverbal language and basic concepts, interest in pictures and objects, ability to follow commands, and object and two-dimensional recognition. Subtest 4 looks at the individual's expressive language abilities, which includes his or her verbal and nonverbal communication, manner and modality of communication, quality of self-expression, object use and interactions, cause and effect, vocabulary, grammar, and phrase length. Subtest 5 looks at the individual's pragmatic or social language abilities, which includes his or her communicative intent, questioning skills, conversational skills, turn-taking, topic initiation, maintenance, and elaboration, appropriateness of communication, reading and literacy, writing and spelling, and memory. Subtest 6 looks at the individual's speech, which includes his or her intelligibility of sounds produced, dentition, and oral motor imitation. Subtest 7 looks at the individual's voice, which includes his or her loudness, vocal quality, and pitch. Subtest 8 looks at the individual's oral status, which includes the presence or absence of mouth breathing, drooling, and tongue thrust, and takes into account the individual's swallowing and diet. Subtest 9 looks at the individual's fluency, which includes his or her fluency, rate of speech, and rhythm and intonation. And finally, Subtest 10 looks at the individual's non-oral communication, which includes his or her use of sign language, two-dimensional expression, yes and no, fine motor abilities, and the effectiveness of their current augmentative or alternative communication system.
Subtest 1 looks at the individual's sensory or motor skills. The examiner is to check a box titled Not Applicable Due to Sensory Loss if the individual lacks the opportunity to perceive auditory and/or visual cues due to sensory impairments, such as vision or hearing loss. Visual skills and field can also be tested by presenting PEX materials, photos, drawings, or a picture book, and observing the level of reaction. The examiner can check with interest if the examinee looks at individual pictures as he or she points and for a reasonable or extended duration, or check mildly attentive if the individual alternates periods of looking and not looking for at least 5 seconds at a time per picture. The examiner can also check lacks interest if the individual requires constant prompting by others with no spontaneous initiation of visual focus. This issue could be the result of poor visual skills and/or attentiveness. Additional example test items from Subtest 1 are hearing, self-help skills, and gross motor. Subtest 2 looks at the individual's attentiveness. This can be assessed by saying the individual's name from the frontal position as well as from the side. The examiner should indicate the level of prompting required to elicit a response, such as eye contact, head turn, smile, or cessation of movement, and indicate a possible reason for the inadequacy or failure of a reasonable response. Options to be checked include on request, no response, with sign, with physical prompt, with gesture, may tune out others, and sensory loss. Another example of Subtest 2 is presenting a command and indicating the level of prompting required. These commands are intended to gain or redirect attention and encourage the individual from engaging in inappropriate behavior. In some individuals, it may be advised to express information to inform the examinee how to respond, such as, "Here, hold the ball," as a means of discouraging hand-mouthing or other self-stimulatory behavior. Additional test items from Subtest 2 are attention span and awareness of others. Subtest 3 looks at the individual's receptive language abilities. This can be assessed by determining whether the individual is able to locate a common, named, or signed target object from a set of at least 3 items at a time by pointing, directed eye gaze, reach grasp, or through yes/no questions asked by the examiner or others. The examiner should indicate the appropriate level and means of communication necessary to elicit correct responses. Options to be checked include verbal command, by function, with gesture, with tactile exploration, with physical prompt, with limited signs, with limited items, with sign, and none. By function refers to knowledge of the object when the use is described. Which one do you use for eating? The term with tactile exploration indicates the individual may lack vision, yet is capable of discriminating one item from another when allowed to touch and compare the items. If the individual is successful with a small set of items, for example, only a spoon, ball, cup, or shoe, yet is not able to distinguish numerous other items by name, then indicate with limited items. Additional test items from Subtest 3 are accepts objects presented and object identification.
We will now demonstrate the administration of these 2 test items from the receptive language subtest. Watch as I act as the examiner and Sarah acts as the examinee in the following video. Okay, Sarah, we have 3 objects in front of us. I want you to point to the one that you drink out of. The water bottle? Good job. Now I want you to point to the one that you would use to clean our hands.
The hand sanitizer?
Yes. And then I want you to point to the one we use to blow our nose.
The tissues.
Good job. And now, Sarah, can you please take the hand sanitizer?
Okay.
As you can see from the video, I would indicate on Sarah's profile form that she accepts objects presented to her by request and that she can locate a common object from a set of at least 3 items by function, which refers to knowledge of the object when the use is described.
Subtest 4 looks at the individual's expressive language abilities. This can be assessed by indicating the most common level or levels of expression, regardless of the means, meaning speech, communication system, signing, facilitated, etc. The examiner is to indicate 1 unit if the individual uses 1 sign, or picture, symbol, printed or spelled word, etc. to communicate. He or she is to indicate not applicable if the individual is unable to express. The remaining levels of single words, phrases, sentences, and conversation are self-explanatory. An additional test item from Subtest 4 is verbal status.
Now watch as Sarah and I demonstrate the administration of these 2 test items from the expressive language subtest. I will again act as the examiner and Sarah will act as the examinee. Sarah, can you tell me what you did this weekend?
Sure. I went to the zoo with my family and we saw the hippo and the giraffes and we ate at our favorite pizza place called La Rosa's, and I got pepperoni pizza and my baby cousin came along and it was really fun.
That sounds awesome. What was your favorite part of the zoo?
Probably they have this new exhibit on the giraffes, which was really cool.
That's great, Sarah. As you can see from the video, I was able to determine Sarah's verbal status as a verbal communicator by asking her an open-ended question and listening to her response. A verbal communicator is described in the examiner's manual as someone who speaks to express a reasonable percentage of the time, and the verbal output must be at least somewhat intelligible to others. Also, I was able to determine Sarah's expressive level as conversation because her most common level of expression was that of conversation.
Subtest 5 looks at the individual's pragmatic abilities. The examiner is asked to check several boxes related to the individual's social skills. One is titled Others' Feelings and Thoughts and is to be checked if the individual is able to perceive and interpret what someone is thinking or feeling in place of or despite the verbal message. Another to be checked is sarcasm, if the individual is able to comprehend underlying subtle meanings that differ from the customary use of terms or may imply the opposite meaning and may depend on the situational context. The social cues box is to be checked if the individual is able to read a situation by interpreting the overall intent of the person or persons in the setting and interpret the meaning or implied meaning of actions, including the nonverbal means of communication. An example would be realizing that it is time to leave or that the communication partner wishes to or needs to end the conversation without that person verbalizing that intent. Lastly, the context box is to be checked if the individual presents with appropriate behavior boundaries based upon the unwritten rules of the situation at hand, as in knowing how and where to act in a particular manner. For example, an individual doesn't speak aloud at a movie or laugh at a funeral because he or she understands the situation and has determined the tone and level of formality that is acceptable. Additional test items from Subtest 5 are initiates communication and communication partners. Subtest 6 looks at the individual's speech. The examiner will analyze the individual's intelligibility of sounds produced, dentition, and oral motor imitation. Intelligibility of speech can be determined through the expressive language subtest. Following health and safety measures, the examiner will also look at the individual's teeth condition and alignment with a flashlight and gloves. The objective of oral motor imitation tasks is to see if the individual can independently mimic any motion made with his or her mouth and tongue. Additional test items from Subtest 6 are proficiency level and adjusting speech to improve understanding. Subtest 7 looks at the individual's voice. The examiner is to check a box titled Voice Effect of the Speaker if he or she can understand a message's meaning based on changes in voice that may include intonation, loudness level, pitch, with lower pitch indicating a more serious matter, and vocal quality. Some examples of vocal quality include harsh, meaning angry, whining, meaning begging, and infantile, meaning silly or foolish.
Here are a list of options to choose from the test items just described on Subtest 7.
Subtest 8 looks at the individual's oral status. The examiner is to indicate the presence or absence of mouth breathing, drooling, and tongue thrust. He or she should also take into account the individual's swallowing and diet by providing interview-type questions about these areas.
Here are a list of options to choose from on the test items just described from Subtest 8.
Subtest 9 looks at the individual's fluency. This can be assessed by indicating the presence, if any, of fluency disruptions or stuttering. Options to be checked include adequate, prolongations, irregular pauses, repetitions, halting, secondary mannerisms, blocks, and nonverbal. The examiner should elaborate on the frequency and severity of disfluency in the Communication Weaknesses/Needs section, which is on page 11 of the test form, and/or on page 1 under Level of Impairment. The examiner is also to inspect the individual's rate of speech as appropriate, variable, progressively faster, too rapid, nonverbal, increases for ritual speech, labored/slow, and differs for echolalia. An additional test item for Subtest 9 is rhythm and intonation.
Now watch as Sarah and I demonstrate the administration of these two test items from the Fluency subtest. I will act as the examiner and Sarah as the examinee.
Okay, Sarah, can you tell me a little bit about your family? Yeah, I have my two parents and my little sister, Emma. Emma is 15 and she's a freshman in high school. And I have a bunch of cousins, a bunch of aunts and uncles, and we all get along really nice.
That's great. Thank you.
As you can see from the video, I was able to determine Sarah's fluency as adequate by asking her an open-ended question and listening to her response. I was also able to determine her rhythm and intonation as appropriate by this same means.
Subtest 10 looks at the individual's non-oral communication. Under a section titled Verbal Status, the examiner is to check the non-oral communicator box if the individual uses or is in the emerging state of using any means of augmentative or alternative non-oral communication through a picture set, signing, PECs, alphabet board, writing, head nods or signals for yes or no, electronic device, low technology recording voice output device, facilitated communication, or object symbol board or magnets. This slide shows how sign language is evaluated by use, meaning, and level. This assessment is criterion referenced. Criterion reference tests compare the subject's mastery of the specified behaviors to the specified behaviors. These tests are designed to provide information for instruction, not to compare students with each other. In terms of the scoring methods used on the FCPR, the examiner subjectively inventories the individual's response to items and rates the impairment level for each of the 10 subtest/skills categories. The client's rating is based on various parameters, including severity of impairment, frequency of occurrence, mode of communication, degree of independence versus assistance, quality of performance, and inventory of skills. Guidelines for response ratings are referenced in the examiner's manual. Based on the assessment results, general guidelines are given for estimation of the client's severity level. Here are our references. We used information about the functional communication profile on the SuperDuper publications, TheraPro, Psychological Assessment Resources, and ProEd Inc. websites.